of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I tried to clear the whole last meeting. Well, I don't know. I know they didn't come over here because they want to get closer to me.
So, everybody have a chance to review the minutes?
So moved.
Second. All in favor?
Aye.
Opposed? Motion carries. Resolution 1.
HE1 is a resolution requesting the appointment of Officer Brandon Loomis of the Oswego City Police Department to the Oswego County Traffic Safety Board. He is replacing Deputy Damon Waters. No S. Officer Loomis is highly recommended as he is currently engaged in community outreach efforts and he has experience in policy and grant writing. This appointment will be for 3 years.
So his resume is attached in your package if you're interested.
I'll second.
Oh, it is Waters. There's an S.
Oh, thank you.
Yep.
Thank you very much.
Been moved. Do we have a second?
Move back second.
Second. Any discussion, questions? All in favor?
Aye.
Opposed? You're up again.
HE2, this is a resolution requesting the appointment of Legislator James Krasick to the Board of Health. It is necessary to conform with the bylaws that we appoint a current serving legislator for a 2-year term. Legislator Krasick has been an active board member since 2018 and has served as vice president for 6 years and is now serving as our president.
I'll make that motion.
Second.
I don't have a vice chair.
Frank, go ahead.
No resume?
I'm a winner. I showed you that.
You won the scratch off.
Okay, well, I guess we got to just go by the word. Saying that he's a good candidate. So I guess we'll go by that then. Okay. This time.
All those in favor?
Aye.
Any opposed?
Abstain.
Congratulations.
Abstention. 32 minutes.
Very
Right?
good.
Okay.
Thank you.
Somehow this ended up a little bit backwards this year
I didn't know how to do that.
because I ended up being elected
Yeah.
president of the board before I got put back on the board again. Okay. You're up again.
HE3 is a resolution to request the authorization of a reclassification of one position in the health department. This position is to comply with the updated state regulations of Title 18 of the New York Code Rules and Regulations. This position is currently the Compliance Office Program Administrator, which is an SG30, and the Management Compensation Plan, and requesting to be reclassed to a Corporate Compliance Officer, SG40, Step 4, with a requested salary of $58,137. This position will remain at the Health Department, but will be a chair of a countywide compliance committee quarterly, maintain a compliance plan for the county, and will investigate any violations and or complaints. This position will remain eligible for a partial reimbursement through Article 6 for health department work related to core activities. Any additional duties that is not recovered by Article 6 will be offset by vacancies in our preventive department.
I have a motion.
You got it. I'll make that motion.
Second. All right. Any questions?
Yeah, which we do in the past.
We didn't have one in the past for the county.
So we've been out of compliance?
It's a new regulation.
No, so the, what's happened right now, sorry, hi there. I just looked in the so the health department is the only department that provides direct Medicaid billing services. So Department of Social Services and mental hygiene. Mental hygiene used to, but I believe 2012 they changed that, so they contract out for, they're not doing direct billing services. But the regulations have changed that now they're still brought in under the Medicaid compliance rules. So we've taken the health department's excellent plan that they had and essentially amending it to apply to the county. So the health department, we've been in compliance, we're just updating it, amending it to comply with the new regulations.
So this is something that New York State
Correct.
enacted recently then?
Correct. So we're amending the current plan that the county health department has to apply that county. It's sort of backwards because it has to apply countywide, but it's really just going to mostly apply to the health department, with the exception of sort of a few contracts that the Department of Social Services and mental hygiene under their umbrella will have. It's still going to mainly be the health department, but we have to have a countywide committee, which the compliance officer will chair, and while it's countywide, it's still mostly going to be the health department. It's the New York State regulations. It seems sort of backwards, but that's where we are.
Well, are we going to have, is this committee going to be notified of any particular issues that we have?
Correct. So the updated compliance plan sets out who gets notified of what type of violations and how they're dealt with and all those things. So that's all part of the new compliance plan for the committee and what they have to deal with. And so the current compliance officer, she's only within the health department, and so she's going to have some additional duties outside of the health department as part of, and it'll be somewhat DSS, and mental hygiene is really going to be the only other places where she will have to coordinate with. But the biggest thing is going to be chair of the committee, the compliance committee. That'll be because she hasn't had to deal.
Well, it's not as clear as mud, I'll tell you that so far. That's okay.
I'm doing my best to simplify it.
No, I'm not putting you in that position because, you know, here's my question is, if we're not in compliance with something, it doesn't matter what department it is.
Yep.
First of all, the committee should know, and there's got to be a mechanism of who's accountable to correct it. And if that can't be corrected, maybe it's an employee problem or something of this nature, or whatever the case may be, or we can't find somebody to do a particular part of a job or something. We have to know about it so we can correct it.
So that's what this is. So the health department has been in compliance. I don't want anyone to think that the health department.
No. I'm not saying anything's wrong with our health department. I just want to know why this all of a sudden come up because I've never heard of this.
Yeah. So they've it was December 28th, 2022, the regulations were updated. And so this is to be in compliance with those regulations. So the health department has always had, not always, but they've had their compliance plan. And since they are the only department that directly bills Medicaid, we've not been out of compliance. So there are other counties that really had to update this sooner because they have other departments that were Medicaid billing where they maybe didn't have a compliance plan that was countywide. So we don't, but there are some things we'll have to get brought in under that umbrella with the new regulations at DSS and mental hygiene. I don't know if that's helpful or not.
just make sure we don't have to ever hear about this again.
Well, to help clarify a little bit further, any agency, a nonprofit I work for, dealing in Medicaid has to have a compliance officer. We have a compliance officer.
Correct.
If something goes wrong, it's their job to come up with a way to rectify that as quickly as possible before the state actually gets both feet in the door and say, well, it's not going right. So I'm sure the committee would be updated. We don't need to be involved in every day, can you do this right?
Correct.
We caught it, fix it. But if there was a major issue, yeah, they would come back to the committee and just make us aware that we're in trouble with the state over blah, 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 blah. Again, the health department is fine. It's covering everybody else, anybody that deals in Medicaid. This is part of the state regulations that you have to have a compliance plan. If some people, if you remember right at caucus the other night, that entire compliance plan was attached to this. And it created a lot of questions because they thought we were going to approve the plan. That's not the case, so that got taken out of the packet because we don't approve that. We're just approving the position to monitor it, chair the committee, make sure that the other agencies in the county are in compliance. Fine. I live in that world, so I understood every word you said. But you're right, it's confusing to somebody to look at it.
Well, something else, now you mentioned, and correct me if I'm wrong, please do, because I'm old and
It's okay.
never mind. You mentioned something about DSS.
Yes.
And correcting that. Now, what authority does a compliance officer have over that particular entity to correct it?
So at Department of Social Services, I mean, so this is what goes back to the direct Medicaid billing, right? Providing services directly, and we're the health department is the only department right now that is direct billing for Medicaid. So DSS does not directly bill Medicaid for services that they provide. For example, they contract with Catholic Charities, and Catholic Charities is billing Medicaid for the services that they're providing. So because they contract with Catholic Charities and the services, some of those, and I could be wrong, specific Catholic Charities or whatever, but if the service that they're providing, they're contracting with, is billing Medicaid services, there's somebody that has to be in the contract that we have with Catholic Charities to ensure that everybody's in compliance. That's basically what this now has to happen. But because DSS is not directly billing Medicaid, they don't have to have their own separate compliance plan. So they were not out of compliance for not having a compliance plan because they're not directly billing Medicaid. Whereas there are other departments, specifically like mental hygiene in other counties, are still providing direct Medicaid billing services. They're not contracting out, they're doing it in-house. Whereas here in Oswego in 2012, that changed. So we're only contracting out. But the law now says if you're contracting with agencies that are billing Medicaid, they're now brought into this plan, but it's really like the contract provision itself. It's not going to be the level of compliance that our current compliance officer is doing in the health department. She's not going to have to do the same level of compliance duties because we're not in-house Medicaid billing, if that makes sense. Or if I just confused you more.
No.
Perfect sense. What you said makes perfect sense. It's pretty self-explanatory at this point.
Just a quick question.
Yeah.
Does this expand the county's ability for other departments to now bill Medicaid directly? So if there are services that DSS could provide better than, say, one of the contractors, would they be able to bill
So what would happen is that if they decided to, let's say mental health, mental hygiene, excuse me, if they decided to go back to providing in-house Medicaid, those services in-house, now there's a plan that's countywide that would make that transition easier.
Okay.
Because it's already set up that way. I do caution though, because there are funding things for the compliance officer, and you would probably, if that were to happen, would probably have to have an in-house, a second compliance officer because that would be a huge, really, because our current compliance officer, this is a full-time job at the health department, right? So if at mental hygiene, well, I know it's a division of DSS, that would also be a huge job. So, and it could be, depending on what level of amount of services they provided in-house, it could be something that was added to someone's current position. It may not have to be a full-time, depending on how many services were provided or not. But this does provide a framework that it would be easier to transition that way. You wouldn't have to come up with a whole compliance plan for mental hygiene because we already have a countywide one.
So the intent wasn't to expand
Medicaid
billing, it was simply
correct.
to meet compliance.
Correct.
That's all.
Correct.
Sorry.
It puts the county in compliance.
No,
Because the state's forgiveness of a mistake lasts about as long as it would take for you to go from here to the elevator to the first floor. It is very, very short. And you better be self-reporting it, because if they catch it, it's witch hunt time.
Now, would we be subject to state audit at that point with a compliance person?
I guess, I'm not sure what I guess you're always subject to state audit.
Could be, yeah.
We get audited.
Yeah, and the agencies that are doing work for DSS, they're the ones that's gonna get off.
Correct.
Arise gets audited.
Right, and I know our current compliance officer, she does all kinds of end-of-year reports, and as part of updating the plan, I reviewed all the things that she's been doing, and she's been doing a great job so far.
Good? Anything else? Good questions.
Yep.
All right, so,
Favor?
no more discussion? All right. All in favor?
Aye.
Opposed? I'm not that old, I know what I'm doing.
You look like you lost track of where you're at. I'm just trying to help.
Thinking the next ticket I buy. Okay, you're up.
Final rabies clinic schedule for 2024. I just want to make sure I have full approval to move forward.
That's right, move on.
That's great.
Looks good to me.
So we did,
Thank you.
a couple things got adjusted. I want to clarify again one more time, because I did get a few comments after caucus the other night. With Fulton coming on there, this is a one-shot, let's see how it works. If this is one of those that blows the numbers out, this committee can then take a look at, do we add the city of Oswego with the same intention for people that can't make it to other clinics, and how do we adjust this? We did adjust, if you remember right, the town of Oswego is now on it this year's. So, and that was the only changes that were made to it. Frank, you got a question?
Well, it's the Fulton Community Ice Arena.
That's where they're having it.
Oh, all right, okay.
Yeah.
Didn't know it was called that, okay.
I looked it up online.
Oh, okay, okay, well, it's-
And that's where Fulton wants
I
it.
just call it that, so I, you know,
There was a
I'm from
question
old
about how
school.
I had it last
Yeah.
time. Yes.
because Fulton Community would be the community center.
Right, right.
Yeah, okay, all right, okay.
I just want to point out, I think it's, you know, for their convenience, the health department, they like certain locations, but I think it's important for us to move them around occasionally to different communities so that they do have access, because there are people that will not travel, even if it's only a couple of miles, you know, so we have to make it more accessible to them. And I like the fact that we've been changing the locations, even if it's ever so slightly. We don't have to change the main ones, but, you know, bounce them around a little bit so that all the communities get hit at some point.
I agree with you. I think that's kind of the discussion that we had in here. Frank?
I just had a comment. I mean, I think it's great, okay, everything. The only comment I have is about one of the common councilors made the comment is, why aren't we having one in Fulton? Because we can't get to the outlying areas for our, you know, rabies clinic. But the people that need it the most won't be able to get to it anyways, because they're not going to get the animals on a bus or, you know, a cab or whatever, and they won't walk all the way over to the, you know, to the ice arena to get shots for the dog or cat or whatever. Okay, it's just I think it's great that we're doing it, and I'm really happy with it. Happy that it's in Fulton, but it's still I think the reason that they said it, okay, is kind of bad, because there are people that will get to it if they want to, but the people that need it the most, the ones that won't do it.
Yeah.
They just won't, you know, they just won't.
Maybe you can suggest to that counselor to the city hire a transportation company to help transport the people from east to west.
We do know a bus driver.
That's right, he can help,
We got two bus drivers.
You got one in Oswego, and then we gotta bring one up on Oswego. But, you know, I hear what you're saying. It's just, thank you very much for making that choice to go there. I will bring that up at tonight's meeting. Okay, you know, it's been moved there, and I'm sure it'll be very well received. Okay.
Well, Frank, I agree with some of what you're saying, but, you know, we gotta give it a chance to see what.
No, I'm not saying not to. All I'm saying is the comments that they made about, you know, us not, you know, let's move it into Fulton because we can't get to Scribe or we can't get to Volney, to get our dogs, our animals against rabies, and yet, I tell you, if I wanted to get my dog, shots for rabies and I couldn't afford it, I had a car, I'd get it there. But a lot of the people in Fulton, I've lived there all my life. I know the ones that will go and I know the ones that won't go. The ones that won't go are the ones that need it the most. Okay, thank you. That's all. I'm not saying that it isn't a good shot. That isn't what I was saying.
Well, at least it's available to the people who do want to go.
Right.
So that's all we can do. We can't force people, so we're doing what we can.
Okay. Any other discussion? Discussion's always good. All right. All in favor?
Aye.
Opposed?
We go back.
Next page.
Read the schedule.
I didn't know we had to vote on. I didn't know we had to vote on.
Finalizing.
I didn't see the resolution.
It wasn't.
No resolution.
I didn't think so.
I just don't want to move it forward without approval. That's all. Thank you.
Jim's got other things on his mind right now. He's hard holding. Yeah.
I just wanted it in the minutes that we got
Agreed
it
on
day.
it. That makes sense.
It's on camera, right there.
Stop waiting, everybody.
And then the final request for approval is the second quarter 23 Professional Advisory Committee minutes that are attached.
So you want a motion to,
Yes, please.
that we've gotten them. I don't think the motions, we agree with them, but we know that we've got them to review. Okay.
Whatever it is on
Any
the
discussion? That was the discussion. All in favor?
Aye.
Opposed?
Thank you very much.
You will.
Right, okay. So for year 11, which is 2022 to 2023, the local health department incentive program from the New York State Department of Health focused on expanding the wastewater surveillance. We had consistent sampling among the wastewater treatment plants, and therefore we were able to report data on COVID-19 trends throughout the county, hospitalizations, genetic sequencing, and we were able to compare with the New York State trends. Upon conclusion in August 2023, we received a composite score of 96.2 and was awarded a total of $24,599 for our participation.
Good job.
Thank you. For year 12, the incentive program from New York State focuses on chronic disease prevention and really looking at promoting physical activity. The plan is to assess a community's design and develop an action plan to promote physical activity. Strategic planning and accreditation, we continue to meet weekly and working on the readiness assessment. The plan is to submit the application in March. So we're very excited about that and we are ready. Public health education, a stepping on class is up and running at the health department. A chronic pain self-management class will be starting in April. The team is planning for the National Public Health Week, which is April 1st through the 4th. We have several activities going on at the health department that week. We also are developing a new health awareness report. That name may change, just so you know. It is being developed to improve the availability and accessibility of health information for local health department staff, local providers, decision makers, and community members. We are looking to expand upon our existing resources that capture more trends and threats to public health. We're building new collaboration with providers in the community to collect external data and analyze this incoming data and report back to the community. And we'd like to do this in a way that is accessible and to a broad audience. So more to come on that report. That is in the making. Emergency preparedness, planning is underway given the expected surge in visitors that will impact transportation, emergency services, local economy for the solar eclipse that's happening on April 8th. We've been working with emergency management on the planning and the messaging for this event. We're also participating in a tabletop exercise that is going to take place on February 22nd. Overdose to action. Here's our overdose data. I stapled a little packet for you, and it has the environmental year-to-date data in it also. If you want to take one. Our overdose fatality review team. Oh yeah. I should have already given one.
He's old, he didn't want to walk down.
We're working on the overdose fatality review team. The plans are in the works, so we're just getting all that information together. Our Healthy Families program, we're fully staffed and fully trained. The angel tree that we had in December was a huge success, and the families were so appreciative of the gifts they received. The Office of Child and Family Services has chosen our program manager to be interviewed for accreditation through their Healthy Families of America team because of the obstacles our program has overcome. So wonderful, it's wonderful news. We might be picked to participate in the accreditation program through Healthy Families of America. We will know next week, which is a huge feat as we just really took off this last summer. So exciting news. They are currently at 88% capacity with 35 families enrolled in the program. Environmental, they're also preparing for the solar eclipse. We expect an increase in applications for food vendors and campground operations. Preventive services, respiratory infections continue, although we are seeing a decrease in the flu, pneumonia, and COVID and RSV numbers, which is wonderful. They are trending down. Public health detailing has begun again. Again, I say because this is the third time we have begun again, with staff shifting to different departments or whatever reason for our expedited partner therapy program. Our lead program continues to have new cases regularly. Immunization clinics are still taking place for flu, pneumonia, and COVID-19, and you can get those every Monday and Friday. Routine immunizations are on Tuesdays, and clinics are now by appointment only. We continue to receive referrals and make visits to vaccinate our homebound population within Oswego County. Our maternal child health program referrals are consistent. We are now able to offer our certified lactation services for any resident that needs breastfeeding support. And children with special needs, we're still looking for a speech language pathologist. So if anyone knows anyone, please send them my way. We would love to get someone hired for that team. We're working with city BOCES to try to reach out to families who may qualify for our supportive services and children with youth with special health care needs to help them pay for hearing aids. So again, if you know a family out there that may qualify for hearing aids, we may be able to help. Any questions for the update?
Do something. I'm just curious. This year, let's look at that. How do you get 98% compliance when 719 are not in compliance? Yeah. That's a 66% compliance rate, but I don't, maybe somehow I could be wrong on my math. I know it's certainly not 98% compliance. It says 19 not compliance, right?
That's correct.
Oh, mathematical error, that's all? Okay.
Definitely an input error there. So for the cooling towers of 2024, those numbers.
So there'll probably be a new opening at the health department.
When you
So our audit proves to be you're not in compliance.
For the cooling tower.
We'll check our auditor.
And it's really them inputting data into a system, and,
That's just the new.
Could you add like the year totals on the overdose reports? Like, can you leave 2023 month-to-month totals on there with the total deaths and total overdoses for 2023, and we can compare them from month to month? Is that possible we can put in this report?
Yes.
Because I'd like to see how we're moving in that, if we're going up or down.
You got it.
Thank you.
Question for you, Bill.
Yeah.
On the solar eclipse, where are you hearing in terms of talking about vendors, having vendors around? What are they saying? Is this going to get that many people in this area?
Oh, yeah.
Yeah.
I mean, who predicts this?
Other solar eclipse sites that have had full total solar eclipse.
Okay.
There are people that will
Where-
drive hundreds of miles.
If we can get food vendors to parks and areas where people can congregate and not on the roadside, that's really our plan.
That's a good point.
So we've been trying to push out information to vendors so they want to participate and get into our parks.
Gotcha. Okay.
Is there, oh, I'm sorry.
No, I was just gonna say, we won't talk about the percentage chance that you will not be able to do it, based on.
Right.
But,
Oh, yeah.
but
Well, there'll still be something.
there'll be something, it'll be fun,
Right.
nonetheless, yeah.
Well, yeah.
Is there any kind of organized safety class distribution of any kind, right? Those little, they're like little paper things. Are we giving those out? Is the state
know.
giving them out? Is there
Yeah, the county purchased
county's
a
giving
huge
back?
amount of them.
They
Okay.
go
City's
through
purchasing a huge amount.
Okay,
Yeah.
so
They'll be
there's-
available.
They'll be, the school kids will get them.
Oh, yeah,
everybody
they've-
got 'em.
Thousands and thousands of them have been purchased.
Emergency management is
Yep.
purchased
Okay.
for emergency workers.
All right, great.
I know they've, the school districts have all gotten together and decided to, you know, take the day off or something. They're close to shutting it down. They're already, right now they're closing early,
It's a half day.
but now, then they're gonna talk about even possibly closing.
Right. Just transportation would be right during the solar.
Snow day. Don't use a snow day, that's what it is.
I just have one.
Plus, you still have to run for
I go day to day.
I'm not familiar with, you know, being relatively new, the lead program.
Yes.
The number of open cases, referrals, and then no closed cases. Can you explain those numbers
Closed
just
case-
briefly? Like, does that mean we have 90 open cases of expected, or where people call? I mean, what is the?
So we have 90 open cases.
Open cases.
And we've received 5
But what
referrals.
does that mean? An open?
That means the child living in the home has not tested lower than the threshold.
Okay.
That's
So
not
there's
changed
still-
very fast at all.
It
Okay.
does not. Usually we keep families for a very long time or until they move out, and then we'll start seeing levels start dropping. But if they remain in the residence, it's usually.
Okay. So, but we don't have remediation. Something we do to remediate it, or
We do.
We do, okay.
The cleaning effort that we put in, and then depending on where the lead is located, because we'll go in and test a home if a child's living there, the cleanup effort and or repainting.
Okay.
And once, you know, just so you know, Kevin, once a home has been tagged, if they go to sell that, like the new owners or the old owners want to sell, they've got to bring it into compliance before
Sure.
they sell it.
Right. And it,
Now, that's
Costly.
all over the county or just the city?
No, well, anywhere I've run across it selling real estate, they have to be in compliance.
Right.
It has to be approved by them after they found it,
And is the
before they can
improvement
sell it.
in testing, is that a biological thing where it just the body, it takes a while for, even if the conditions have changed, it takes a while for
it's
the
how
testing to,
it's how
to
the
update?
lead stays in your blood.
Okay. Perfect.
It does, and
Thank you.
it does cause it can cause havoc.
Yeah. I know developmental disabilities and different things.
Absolutely.
Yeah. Okay.
Decreased graduation rates, increased
Sure.
crime rates, lead can do a lot. So
But we keep track of,
we do.
excellent.
And any child that has a lead level under 5 becomes ours, as long as they're tested. And they're supposed, all of them are supposed to be tested, so.
Is it?
That's all I have.
Sure. Just so you're aware, as we talk about Medicaid, I am a new Medicaid enroller.
Ooh, congratulations.
Thanks. I forgot to step back when I asked for somebody to step forward. Everybody else.
Same, you're it.
It's interesting. I'm still new and frustrated.
I'll make the motion.
Go ahead.
Oh, no.
You have a question?
No.
You wanna wave at the camera one more time?
Oh, I asked the question.
Okay.
I take care
We're
of
adjourned, right?
We're adjourned.
I take care of business.